Now, of course, I told you we had a very busy show, and we do, and it's time for another guest. Now, over the last month or so, or 5 weeks really, since I've been taking on a few more shows at Vibe, I've been lucky enough to speak to the most diverse cross-section of people from our community, people that are doing the most wonderful things at such a difficult time. And you know, we often have a laugh here on Vibe on the Drive Time show, but I think as well we have to spare a thought, or at least some of our thinking, for places that are struggling a bit. Now, my next guest is Declan Carroll. He's CEO of the Peace Hospice Care here in Hertfordshire, and they're having a little bit of a tough time. Declan, are you there?
I am, yes, Benjy. Hi.
Hi. So, welcome to the Drive Time show. As I said, we've been speaking to people from across our community that are struggling. What are the challenges that the Peace Hospice are facing right now?
Well, obviously, for anyone really nearing sort of end of life, it's a challenge both for the individual and for the family. So for us at Peace Hospice Care, it's about making sure that we can continue to care for our patients in our inpatient unit or support the patients at home in their community setting. So challenges really we face is obviously the financial challenge. We've had to close all of our charity shops, like most charities up and down the country. We've obviously had to postpone a lot of our fundraising events. So, you know, that's a huge income for us that we need to think about how we manage that going forward.
And I guess you touched on it. How are patients able to say goodbye to loved ones or stay in touch with loved ones? Is it really calling on as much technology as we can get our hands on to make us feel as close as we can? Yeah,
so obviously, you know, our priority is safety of patients and staff, so we've had to restrict certain visiting regulations actually in the hospice itself, but we are using, you know, new ways of communicating, so video technology, lots of conference calling, lots of video callings between loved ones and patients, and obviously through our clinical team and patients at home as well. So just a different way of, I suppose, communicating and keeping in touch.
Now, it's just come to my mind. I was reading the most interesting piece in the Sunday Times last weekend, busting myths about hospices. Because when we think of hospices, we think of very sad and sombre places where we spend our final days. But, you know, I suppose your nurses have got quite their work cut out to keep these places cheery and keep people kind of, you know, still enjoying their lives while they still can.
Yeah, it's obviously a challenging environment, but we've got an amazing team of nurses, healthcare assistants, and the clinical team. The hospice is a really uplifting place. You know, we're there to support not just the patients through this difficult journey, but we're also there to support their loved ones, their relatives, their friends, and their carers. So, you know, I think it is about, you know, making sure that there's a bit of dignity and there's a lot of respect, but also we're there for the human touch as well, I think, which is really important.
Yeah, as you say about the charity shops in Boreham Wood, the Peace Hospice charity shop is my charity shop of choice. So I'm gutted to see it closed for the time being. Now, Declan, there are some things that we can do at home. The ways in which the public can help out. What are they?
So obviously we still need protective equipment. So anybody that wants to donate any personal PPE equipment of any type, obviously fluid-resistant surgical masks, hand wash, etc. Please, if you're at home and you're having a bit of a tidy up, keep hold of any of your unwanted items. So, you know, obviously our shops are closed, but we will reopen again shortly. So, you know, we would be looking for those donations in the charity shops when we're open. Obviously, continue to look at our website, and perhaps financial donations will clearly help us through this pandemic. Share our news, our stories on social media. Just talk to your friends and your colleagues and just spread the message, really, that Peace Hospice Care is the local charity. We do want your support, and obviously the more support we get, the more people we can support in the community.
That's brilliant. So there's 4 things there. There's PPE, fluid-resistant masks, hand sanitizer. We've got holding on to our unwanted clutter. If you don't have a use for it, someone else might have a use for it. They might even pay some cash and donate some money for it. Financial donations. If you can dig a little deeper, spare a few quid, then I'm sure you guys will be happy to receive it. And sharing news, talking like we're doing now, sharing people's stories, because, that's how we keep making change and moving things forward. Well, Declan, I really hope that the charity, its day-to-day operation can continue in the highest kind of regard, and I'm sure within no time your shops will be back open, and hopefully some kind of normality can resume for your staff and, of course, your patients.
Thank you, Benjy, and I just wanted to sort of say a big thank you firstly to our staff who are doing an incredible job, but also to Vibe and all of the local community that have supported us so much over the past few weeks. We really do appreciate it, and please keep that support coming. Thanks.
Brilliant, thank you. That's Declan Carroll there, CEO of Peace Hospice Care, telling us how we can help them. Of course, we can raise money for NHS together. That's really important, but it's as important to look close to home, local charities. If you can help, please do.